Thank you.
Perfect. Well, welcome. Let's see, I'm waiting. So we have Allison and Courtney from your staff, and we have Senator Merkley here with us. I'll give a little brief introduction, and I'll kick it off and kick it over to you. I just want to make sure I'm muted over here on the Facebook page, otherwise it'll feed back with me. So real quick, let me just do this. Well, good afternoon, everyone. And I'm Tiffany Edwards. I'm the Director of Business Advocacy for the Eugene Area Chamber of Commerce. And I want to thank everybody for joining us today for our webinar. We're going to be recording this webinar, and it'll also be available from our website at eugenechamber.com after the broadcast is complete. So as I said, we have folks joining us by Zoom and as well as our Facebook Live page. And so if folks do have questions, feel free to just type them right into the chat, and I'll make sure that they get answered. And we do already have a few that have come into us. So a very esteemed guest today is our U.S. Oregon Senator Jeff Merkley. He's joining us from home, it sounds like, versus in D.C. We're very thrilled to have you joining us. We've been getting daily updates, and your staff has been amazing at keeping us posted and abreast of everything that's going on. So we just want to thank you for keeping us always updated in this constantly evolving situation. So Senator Merkley, I thought we'd go ahead and have you just kick us off and provide an update on the latest round of our federal stimulus 3.0 and 3.5, and then talk about anything else you'd like to share and think that might be helpful for businesses here in Oregon to be aware of, and then we'll open it up to questions.
Great. Thanks so much, Tiffany, and thank you for the invitation to join you all. I want to start by just introducing members of my team that are on this Zoom room gathering because they're an important link, an opportunity to follow up, and then we'll be following up with questions and issues that are raised that we don't have an immediate answer to. So Courtney Flathers is my field rep. She's on the call. Allison Hahn works on financial policy, banking policy, everything related to the small business loans and grants in DC. So Allison Hahn is with us here in the Zoom room. And Jake Okenberg is my small business liaison. And he's been very, very busy, as you can imagine, because of all of the issues that have come up in the context of either the legislation or the implementation of the legislation by the executive. We're in an extraordinary time. Who could envision that some version of a coronavirus, the common cold is a coronavirus, could bring us to this level of infections and lethal infections, deaths? That challenge would bring an economic implosion to the extent that 30 million people have lost their jobs in the last 6 weeks, 30 million and counting. It's extraordinary. We didn't have this fast, this deep a crash in the Great Depression, in the situation that we had back in the recession of 2008, 2009. We were losing about 1% a month. We have lost 20% of our jobs in 6 weeks, 20%. So phenomenal blow and deeply disturbing on both the medical front and the economic front. So there's a lot of anxiety that goes with all of this. Some of the things that are essential for us going forward, one is to absolutely get to the point where access to personal protective equipment, PPE, is not an issue. It still is an issue. Many of us on both sides of the aisle have been pushing the administration to use every tool they have to gear up production. That has not been something the executive has wanted to pursue aggressively, that President Trump hasn't wanted to pursue. So we're in that situation where we still have a lot of shortages. We have shortages in the retail space, and we have shortages for the surgical masks and the N95 masks in the healthcare space, which is a both are a big problem. And then we have the actual tests themselves. So what we have to be able to do in Oregon to really get to the point that we are making progress towards and shutting down this crisis, is that we have to be able to contact everyone who has a positive infection and reach out to everyone they've been in contact with for the previous 2 to 3 weeks, get to every one of them and have a test so we can catch those cases where people are asymptomatic infections. And by this tracing, it's been very effective in other countries. South Korea, which had a very effective tracing program, has reached zero, as of yesterday, zero local infections. They still had 4 imported infections, but that's where we need to get to. Well, we need the testing backup to be able to do that. And then for everyone who has any symptom to be able to get tested. So my wife, who is a nurse working in a hospice space, is an example of this on both fronts. So on the PPE, she had 1 mask per day, and it wasn't a surgical mask, and it wasn't an N95, and yet she was being sent into homes where people were very sick, could easily have carried the virus, and into homes that had been identified in a positive fashion. The protocols were changing daily. There was huge anxiety among the nurses, not just that they might get sick, but that they might bring the infection from person to person or bring it to their home and impact people in their home as well. That's improved a little bit, but it has a ways to go. My son, who works as a medical scribe, they didn't have masks at all for him until a few weeks ago. And that protocols are changing there. Meanwhile, Mary got sick, and my wife, and she had at least 4 of the symptoms associated with coronavirus. She had a sore throat. She had a fever. She had body aches all over. She had a dry cough. And so she was able to get tested, and the test came back negative, thankfully. But everybody who has a symptom has to be able to get a test to know immediately if they need to be in quarantine, and people around them need to be in quarantine. And so just a little bit of personal example there of the challenge on the PPE front and the testing front. The bill we just passed has an additional $310 billion for the PPP program. The idea is to help small businesses stay open. 60 billion was set aside for businesses in underserved communities, and of that, half of it, 30 billion, has to go through institutions like the very smallest credit unions and banks that serve those underserved communities. So that was something I pushed very hard for, because I heard from so many folks across Oregon that they're very small businesses that didn't have, they weren't on the top of the list for their local bank. They might even be a customer of that bank for 20 years, but they didn't have a huge account with them, didn't have a lot of loans with them, that they were just getting the door shut in their face. So we have to have the door open for our very small retail businesses. And so that's the goal. Implementation has been rough, so I'm taking feedback on that implementation, and we'll keep adding to adjustments in the next bill, the Corona 4 bill. In addition to the PPP track, there's the Economic Injury Disaster Grant track, and it's an alternative. And in that track, the problem we've had is, although the design of the legislation was that a small business could get up to $10,000, well, the administration put a rule on it that said only $1,000 per employee. So if you have 3 employees, you're limited to $3,000. That doesn't go very far in paying your rent, your mortgage, your so forth. So that's just simply, we've asked for the administration to lift that rule. Hopefully that will happen. And if that means we run out of money, we need to immediately put more money into the program. So that's just a few of the pieces. I think rather than my go on with the details, it's better to open it up to your questions and your feedback that my team and I can use in the next round of legislation, or that we can advocate for changes in how the programs are being implemented. Let me turn it back to you, Tiffany.
Yeah, great. Well, thank you, Senator. I do have a handful of questions that, obviously in my role with the chamber, I'm dealing with my advocacy role listening to all of the concerns and things that are happening in real time, as certainly a lot of things have rolled out, and sometimes we didn't always know exactly what that would look like until we actually started to see the implementation. One of the things that has come up, and I'm curious to see maybe if you all at the federal level are considering how it might tackle this, but the restaurant and hospitality industry in particular, and many of those folks were qualified for the payroll protection program loans, and they've received that money, but yet they're still not able to open their doors. And so they have to spend that money on payroll, and they don't have the folks employed necessarily to, a lot of those folks were laid off and quite frankly are staying on unemployment. And so restaurants and lodging facilities had a tough time trying to either bring folks back so that they can convert them to PPPL funds. And I'm just curious if there's any talk among your colleagues as to whether or not you might consider extending the time that they have to use those funds. Because obviously otherwise you're going to have a situation where businesses now have loans that they were expecting to be forgiven, and that's a new financial burden for them. So I'm curious of where that's going.
So kind of the framework that was envisioned when the legislation was passed was two paths. One, help by strengthening the unemployment insurance so you could lay people off and they would not be economically injured by laying them off. And the extra $600 per week, $2,400 per month, means that most people in the retail world would be earning or receiving as much under the unemployment as they would if they were actually at work. The alternative was, but if you can keep those people on your payroll and not put your team through unemployment, not put them through having to get interim health insurance and have them ready to go when we get to the other side of this, that would be a great thing to do for your team members. And then you get 25% on top to be able to help cover your rent, mortgage expenses, and so forth. That was the vision. And what I'm hearing from a lot of restaurants and so forth is, look, we've already laid people off. They've already gone through that adjustment period. Pulling them back, and then in 2 months from now, we may not be able to open anyway, and then laying them off again doesn't make sense. So can we take and use those funds instead for when we hire people back as we try to get back on our feet? And I think that makes a lot of sense. So that's an adjustment that I'll be pushing for in the next bill, but it's not an adjustment that exists under the current law as I understand it.
Okay, well, great, thank you. That's actually helpful. I have a couple of questions, and they're not in any specific order, but I definitely want to try to get to them. We did have a question, and I just want to let the viewing audience know. It was a question about your wife, and that they were curious if they were talking about the county or the state in regards to PPE. And it sounded like Jake responded and just let folks know that that Mary is a hospice nurse in Oregon. So put that out there.
She works for a private hospital, nonprofit hospital. Yeah.
Well, thanks for that info. So we have another. So we've heard that in the next COVID bill, it may be far more political than even what we've seen so far. Can you maybe talk a little bit about what's being discussed as far as what might be included in the next COVID-4 bill, and what are some of those components perhaps?
Yeah, so what we're going to find is that some of the things that were in the last bill, number 3.5, are not going to go well, and we're going to have to make adjustments so that they go better. For example, in the 3.5 we just passed, there's more funding for healthcare with an intention to really try to help out our rural hospitals and our rural clinics, which have seen a huge decrease in their revenue as non-essential appointments were canceled. So that's very important for that to go effectively. If it runs out of money, or if it is not getting distributed as we envisioned, we're going to have to adjust the law for that. We've got to keep our health system healthy. So that's a piece. A second is our state and local government. We try to get more funding for the state and local governments in the 3.5. That did not make it through the Senate leadership. So we're going to try again because the drop in revenues is enormous. In the funding that exists currently, the guidance just came out last week for how it will be distributed, but the checks haven't arrived to the state. And the state was under the guidance that 45% was intended for local government. But the rules that are established say that you can only use this money for new COVID-related expenses. And the problem with that is our state and local government are hemorrhaging cash. Income tax is going to go way down. We don't have a sales tax, but where people do have a sales tax, that's going to go way down. Local government, the property tax, a lot of people aren't going to be able to pay. So that's going to be an impact. So getting the flexibility to be able to use those funds to address the crisis, and addressing the crisis means helping state and local government with the revenue as well as with new expenses. So, and that appears like it's going to be difficult to do in the Senate, in that the majority leader has said basically, well, let's let the states go bankrupt. Well, I do not think letting states go bankrupt is the answer to a quick recovery, economic recovery, when essential services are needed by our population now more than ever. So that'll be an issue we'll be working on. Another is safe voting. There is a bill that Ron Wyden and Amy Klobuchar have championed, and I'm a full co-sponsor partner in it. That says let's take the model from Oregon, and Minnesota has vote by mail, and let's do it across the nation so people don't have to go to the polls. This is fiercely opposed by the Senate leadership because, just to be frank about it, the manipulation of polling places has been a strategy used to keep people from voting that the majority in the Senate don't want to vote. Low-income communities, minority communities, college campuses, Native American communities. And so they fear that vote by mail will help those communities vote and take away tools like understaffing polling places, changing location of polling places that have been used to manipulate and stop groups from turning out. That is really, in my mind, absolutely pathetic and unacceptable under our democratic republic. If we believe in the vision of government by and for the people, we should believe in voter empowerment, not voter intimidation or voter suppression. I'm preparing a backup compromise as a possibility, which says that every state has an absentee ballot program. So simply make this November a moment in which any citizen can ask for an absentee ballot so that they don't have to choose between getting sick at a poll. And so it would leave the voting at the polls in place, but anybody who wanted could get an absentee ballot. I hope we get some kind of compromise on that, but that's going to be a difficult issue. There's lots of bipartisan support for looking at infrastructure, but the design of that infrastructure portion is going to be something we will wrestle with. The administration had an infrastructure vision that involved 80% local funds, 20% federal match, which is flipping on the head the existing infrastructure formula of 80% federal, 20% local. Quite frankly, if any entity has 80% of the funds currently, they can build a project anyway. It'll just be a smaller project. So that formula won't give the ability to start big new projects that could help us recover. And it's infrastructure we need. We are being outpaced by other developed countries on infrastructure, on broadband, on port jetties, on port docks, on waterways, on roads, on bridges, on mass transit, you name it, we're behind. And so this is a moment when borrowing is near zero from the Fed. That's the smartest time to borrow to do infrastructure. So I hope we can work that out. So those are some of the issues in the coming bill.
Great. Well, thank you. So I have a couple of questions from our Facebook audience. We have one here. So when, I think it's when and how will the idle be dispersed? And then there's some context here. They've received a confirmation of their application and the grant money arrived with no notice, but then they're not hearing anything about the idle. And so then the second part of that was through their lender, the SBA lender banks have been told that they're not participating in the bridge loan program because that program requires IRS transcripts. But the IRS is not processing transcript requests. And so this viewer asked, how is it possible to access that program?
And by transcripts, are we talking about copies of former tax returns?
I think that might be what they're referring to. I'm not quite sure. If it's a question, maybe that your staff can hop on and look at.
Yes. When we get into the complexity, I turn to my team, and I'll just invite Jake or Allison, who are working on these deals. If you have anything to add right now, I'll just note that. So you have a loan program that is also a grant program. So there's the Economic Injury Development Loan Program, but there's up to a $10,000 grant under that program. So it's like idle loans and idle grants. And it's important for businesses to know which they're getting and the rules under which, if it's a convertible loan, that is clear. Like, yes, it's a grant unless you spend it on the wrong things and then you have to return it. It's essential that businesses know exactly what that is. They don't end up in a blind alley and have to return the money to the federal government when it appeared to be a grant. We can have Jake follow up with the individual who's asking the question. If we can get that after the call, maybe Tiffany and Jake can work that out. And let me just see if Jake or Allison have anything else they want to add right now.
Yeah, can you hear me all right?
We can hear you.
Yeah, I would just say I'm getting a little bit of clarification, and we can follow up with Sam, who asked the question. But in terms of EIDL or EIDL, the SBA unfortunately has not been very transparent on that, and their advice at the local and regional level has consistently been, hey, you got your number, sit tight, it'll eventually show up or not. We obviously don't find that answer terribly satisfactory, and the senator has actually submitted a number of letters to SBA asking them to allow people to have better understanding of where their loan exists. But right now, they're not sharing that info with anyone in any state.
Oh gosh, okay, that's good to know. Because one of my other questions here was that for businesses who have applied and that they applied in that window where the money was gone, and so then there was another injection of into that program. And they're still just kind of waiting. And so the question was that what can we advise them as far as who they can contact to just know where everything is at in the process?
So my understanding was that if you had submitted your application and had been received, you didn't have to resubmit it. But that makes me really nervous because in this overwhelming response, we've never had so many people apply for loans, small business loans at the same time, or so many people apply for unemployment insurance. It makes a lot of sense to double check every piece of it. My understanding is folks were supposed to be able to have a record number or a confirmation number that allowed them to check on the status. But Jake, help us out here. What are you hearing from the businesses you're talking to?
Yeah, unfortunately, though, folks do get a number confirming that their application has been received. We have heard varying reports about what people can actually learn with that number. And just as early as a couple days ago, the local SBA folks were still saying, just sit tight, it will show up. But you can't look it up anywhere online. They won't necessarily know if you call the SBA 800 number if you can get through. It's incredibly frustrating and not a sufficient answer.
Okay.
So we're pushing the administration, hire more programmers, hire more response folks, and they probably are because they're getting the same feedback from all across the country. Obviously, the administration wants the program to run smoothly, but it's been rough.
Yeah. Well, I have another question here about, it's kind of a more general question, but gosh, I mean, it's more of a structural question about the economy. And the question is, how much longer can the federal government continue essentially writing checks to individuals and businesses, given the declining revenue projections from taxes that are not being paid by individuals and businesses? I'm curious at your thoughts on that. You did mention the low cost of borrowing right now, but I'm curious as, how long can the federal government keep sustaining us through this?
Well, so a couple of thoughts that various economists have pointed out. As long as the world is in chaos and people are seeking safety through U.S. Treasury bonds, borrowing is cheap, and that's backed up by the Fed keeping interest rates really low as well. So that's one answer. The other answer is we have to recognize that when the dust clears, uh, even if the interest rates are low, it's still an increased interest expense in the budget that can squeeze out other important things. And if interest rates go up, it can quickly eat up our budget for everything, basically. And so that's the danger. It's probably less of a near-term danger than a danger a couple years out when the world's on a normal path and people decide that there's other places they can put their money for safely with a better return. And so our interest rates go up, and now this is a problem. I kind of ache over this issue of the deficit. For example, into the last bill, Chuck Grassley, the chair of finance, and Mitch McConnell, the majority leader, put into that bill $170 billion of tax cuts for the richest Americans in the Corona 3.5. This reflects several big problems. The bill is negotiated at the end by the four corners, the leader of the Democrats and Republicans from both chambers. The bill is massive. It's then we again get a short briefing and have to vote immediately. And what we hear are the outlines. And so we didn't know about what had been put in, and that just should never happen. It's when I was Speaker of the House, I insisted that every bill had to, in the Oregon House, had to be fully public so people could vet it, people could vote knowing exactly what was in the bill. That's the way it should be for the U.S. Senate. But this is one of several deep functional problems, and it's probably relatively true on the House side as well, because the same bill got very short notice before the House voted on it. They actually got a couple days in between the Senate and the House vote, so maybe less so, but it's not unique to one chamber or one party's leadership. So there's $170 billion right there of additional debt that is not helping us with healthcare, that is not helping with housing, it's not helping with infrastructure, it's not helping us take on the coronavirus. Why? We're just digging a deeper hole than we have to. Not to mention the 2017 bill, which was $2 trillion of hole that was almost universally went to the richest Americans. So we're not on a good track in this regard. When we borrow, it should be for essential elements that build the future economy, like infrastructure, or immediate challenges like the crisis we're in at the moment. And that's not where we're at. But those are some thoughts on that topic.
Thank you. So I have another question from Maria. So let's see. There's a $20 billion remaining in emergency funds that Congress designated for health care providers or health providers. That's what it says. HHS has not included Medicaid funding disability supports in any of the previous funding allocations. Those have been primarily Medicare focused. The question is, will HHS be including disability Medicaid supports in future allocations?
I absolutely do not know. I haven't heard this particular question. The idea was to keep all of our key healthcare institutions whole, if not whole, at least afloat. And the first distribution was based on Medicare A and B as terms of where the funds went. We were pushing for future distributions to reflect a lot more help for our rural hospitals. It had deeper drops and less resilience than some of our urban hospitals. The but the law gave a lot of flexibility to the executive to decide where and how these funds were distributed. So we're taking feedback on where the rubber is hitting the road and we have problems, so we can investigate them and propose set-asides or guidelines for the next set of funding. So this is an area where I'd like to have Courtney and Allison follow up with the person who's asking the question. Make sure we understand it well. Medicaid disability, what is, where exactly, so we can look into the funding, where is the financial crunch in that particular issue? What does it need and how do we fix it?
Okay. Larissa asked, economic recovery will of course be key, and employment is a huge part of recovery. Is there a will to consider a new works progress administration to rebuild the economy as well as U.S. infrastructure?
So people are starting to talk about how we're going to boost reemployment. Is it going to be enough to help our small businesses reopen, or are we going to need kind of a parallel track where we have government programs to put people to work? Maybe, for example, in the 2008, 2009, I was pushing for funds for a lot more people to be able to work thinning forests. We have these it's just an example, but we have these second growth forests that are incredibly crowded and need to be thinned. They're a fire hazard. They're not good ecosystems. And it's not cost effective to commercially to thin a lot of them. So maybe that's an area that we could put a lot of people to work if needed. And there's other things like that across the country that could be done. It has not been a core conversation to date, but as we start to see that the curve is flattening across the country and we're thinking about how to reopen the economy, this is going to be a relevant and important piece of the conversation.
Great. So along those same lines, has there been discussion about preparedness actions beyond this particular crisis that we're experiencing right now? Obviously, gosh, now that we've experienced this, we've realized how vulnerable we really can be. I'm curious what kind of contingency plans that you all are talking about at the federal level.
There is a strong sense that this has revealed real flaws in our healthcare system. One of those is the number of folks who are uninsured to begin with is still significant. A lot of states didn't expand Medicaid, even though the federal government was picking up for the first few years 100%, and then 90% in a graduated fashion after that. But it became a political issue in a number of states. Our ability to respond quickly in terms of how we can gear up production shouldn't be something we figure out when the next crisis comes. We certainly need to understand exactly what we could have done to gear up production for PPE, gear up production for essential medicines, gear up production for essential equipment like ventilators, gear up the tests. So how do we design a strategy to be able to respond quickly? We had MERS, we had SARS, we had this. This is the first time that it became a pandemic. But those were kind of shots across the bow, the MERS and the SARS viruses. And so if we think that this won't happen again, we're probably very wrong. And so let's plan on how to respond fast and effectively. So I expect there to be a healthcare bill as we get out of crisis mode to say, okay, what were the flaws that were revealed in our healthcare system and how do we rebuild? And I know I hear across the state, blue counties in Oregon, red counties in Oregon, the desire for a much more simple, seamless healthcare system, which I certainly support. We're covered just by virtue of living in the United States, so we don't have to have that piece. And I'll tell you, folks are telling me like the stress to go on COBRA, to figure it out, to figure out what it costs, to figure out how you're going to pay for it, that is a big deal. So when small businesses lay people off, even with a robust unemployment insurance, with that extra 2,400, 2,500 bucks per month, COBRA can eat up about 70 to 80% of that right away, of that additional federal support for it. And if you don't have that additional federal support, in normal times we wouldn't, then your health care benefit can eat up your entire unemployment plus. And so that there's multiple issues that we're going to have to learn and improve on, hopefully, as we go forward.
Yes. Well, thanks, Senator. So I have another question from Chris Edwards, who says hello, and has a question about, at the state level, it's been actually surprising to see that the Republicans and Democrats have kind of come together and are working a lot better than they had in recent past. And a lot of that is just around common objectives for what they're trying to accomplish for Oregonians. And so his question was, do you see anything similar happening at the federal level? And maybe you could speak to any kind of dynamics that may be improving as far as the partisanship that we were seeing for so long.
Some, but not at all sufficient. I think this is a moment that I craved, the possibility of our president standing up without any partisan comments, without any political references to governors he likes and governors he doesn't, states that are blue or states that are red, and just said, we're all in this together. Here's how we're working together to solve it. And I would have liked to seen both the majority leader and the minority leader be able to stand up together when there was a plan to go forward and say, we've worked together. We're not coming forward to grandstand on the floor and say, well, I've got a plan. Where's the other side? And I've been disappointed. I've been disappointed by the Senate leadership and by the president in terms of retaining and holding on to partisan language and commentary in the midst of this. We are in an election year, and so I guess that's hovering there in the background. And but this is the type of moment that would have been a beautiful thing for us to see that more set aside. Now there were significant bipartisan moments after initial jostling, and then kind of, okay, well, let's work together and get this bill ready. And so in the end, we passed several bills by unanimous consent because the negotiations were done. Everyone said this is a reasonable way to approach it. Of course, not always knowing all the details that were in the bills, and we passed it by unanimous consent. So we've done that several times. So some element of improved collaboration, but not as much as I think we crave.
Yeah, well, that's maybe a little bit of bright light on the pencil there, right?
We need a little bit more of the Oregon way to take that and translate that to the national stage.
Well, we do have a question from somebody who's asking kind of a little bit along the lines of the more, it's a question that relates to Governor Brown. So Jason's question is, so there are some saying that Oregon's constitution only allows the governor a 30-day emergency without having the legislature need to step in and extend that. I'm not sure what the full legal opinion of that is, but this participant had asked if you had an opinion on why the legislature hasn't extended Governor Brown's emergency declaration.
No, I don't have an opinion because I hadn't heard this issue before. So I've been on a number of calls with the governor, group calls. We just had a delegation call that didn't come up. I've had a lot of individual conversations, tons of these Zoom room dialogues. Haven't heard of that legal issue coming up, so I'm not familiar with it.
Okay, yeah, and I actually hadn't heard that either. I know that there is plan for a special session. We're waiting for a forecast, revenue forecast. So beyond that, I don't know a whole lot. But I do want to go back to, we've had a couple of folks chime in about the issue with the PPP. It's a restaurant owner that's paying employees full wages and is following all the rules and just struggling to find a path to being able to spend that within the 8 weeks. So I think he's probably curious about what we can be doing to help to advocate with folks at the, folks at the federal level, as far as they'll have those stories be told and how much of an impact that we could be having.
Absolutely. Well, I think this is an example of where it'd be great for the National Restaurant Association to really collect those cases and examples and help reinforce the argument for much more flexibility. If one has all of their staff still on board, that accounts for essentially the base amount of the PPP, but that extra 25% on top, if you're not opening your doors and you own your own building, for example, you're not paying rent or mortgage, your utilities are very low, then you may not be able to have a way that you can even spend the other 25%, which in some ways is just to say that, well, that'd be great because it means it's covering all your expenses, all your relevant expenses right now. And isn't that wonderful? But on the other hand, owners are thinking, wouldn't it be helpful to use this money outside of the 2-month window? Wouldn't it be helpful to have an extension and be able to help get back on the feet as the economy is opening? So maybe we're able to open up our, just choose a dining room that we can only see a third of the people we sat before because of social distancing in the initial phases. So our revenues are still going to be low, but our proportional costs will be high. Shouldn't we be able to, wouldn't it be helpful to have the flexibility to use the funds in that setting? Yes, absolutely. I certainly support that. And then the question will be, and are we going to need for it to be more than 2 months? I mean, here we are for the last 2 weeks or, almost 2 weeks. We've been at between 50 and 60 cases a day on a rolling average. If you take a rolling 7-day average, so you're kind of spreading it out. And so we are not seeing the disappearance of cases in Oregon. We're going to have to be very careful about how we reopen. It's not going to be like we just open the door and we're back right where we were before this crisis hit us. For businesses that are seasonal and their biggest season is the spring, summer, early fall, I mean, they're really going to be in a world of hurt that's different than just the first 2 months. So this uncharted territory we're in, we're going to have to keep wrestling with it and figure out where more flexibility and more resources are needed.
Great. Well, I do want to be respectful of your time, Senator. I have one final question, and if there are any other questions that come up, we'll definitely follow up with our audience and with your staff. But my question, I would be remiss if I didn't mention that one of the things that our chamber has been advocating for with you all at the federal level is none of the options for relief have included 501c6s. And chambers of commerce, like ourselves, are 501c6s, and we have been leaned on more than I think ever as far as supporting the business community and providing. We've been a resource. Our entire staff has been working diligently, and so it's kind of one of the things. And I'm just curious from your perspective, what is the thinking behind why 501c6s are not eligible for some of the loans that other businesses have been able to access?
So essentially, the 501c6s have not been eligible for the PPP, but have been eligible for the EIDL. But there's a lot of confusion around that piece. Are they eligible just for the loan part or for the grant part? And a lot of uncertainty as to how much the revenues are going to drop. For some chambers that are that have an annual fee that's kind of done once a year, their revenue's in place and it's not on a monthly basis. Others that depend on the monthly basis, or if they do their annual during this crisis, their revenues are going to fall dramatically. How much has the Eugene Chamber's revenue stream been affected so far, Tiffany?
That's a good question. And I'm not the best person to answer that. Brittany might be able to chime in.
Yeah. So, I think it's kind of been, Senator, just a perfect storm, right? With the events being canceled, that's a huge component of our revenue stream. Sponsorships from businesses who are contributing a lot of times to support those events. And then the third is those membership dues. We collect dues on a monthly basis, and our revenues have been impacted pretty significantly. Unfortunately, we've also applied for the EIDL loan and have not heard a single thing about it. And so without that in the PPP, it's definitely been an interesting time financially for our chamber, and I know we're not alone.
And Brittany, in that application, did you find it was clear whether or not $10,000 of that could be a grant on your EIDL loan?
It is, yeah. So the $10,000 was eligible for us. We were eligible for that.
So I led the Senate effort to get the 501c6s for small chambers included, and lost that battle. And the response that I got was because chambers 501c6s are political organizations in that they lobby on issues, is why they were excluded. I argued that, look, they're yes, may lobby, but they also are service organizations. And what service is more important than helping our small businesses figure out this PPP and these EIDL? And so at this moment, small chambers, I'm not talking about national mega 501c6s that employ 100 people and lobby in DC. I'm talking about ones that facilitate small local businesses being able to utilize these programs. So I'm raising this again on the PPP. Our team is ready to try to help facilitate applications under the EIDL program and that $10,000, because at least that can help. So Courtney is my field rep and Jake is my small business liaison. Feel free to contact either one of them to see if we can be helpful in your situation. I would have liked to see the PPP be opened up as well, but I lost that battle and I'm going to try again.
Thank you. We appreciate that, Senator.
Yeah. Yes, and thank you, Senator. We are so grateful for you and to your time that you've given us this afternoon to just check in, and we appreciate all your insight, and staff, all of you. You guys are great. You're doing a great job, and we definitely utilize the resources that you're sending us constantly. So thank you. If there are any other questions, I'll make sure to follow up with Courtney, and want to just wish you and your family the best, and take care of yourselves and stay safe and stay sane here.
Stay sane. And I do wish you all a healthy future. And it's a moment where acts of kindness, planned and random, are so important for us all to get through this, especially when we can't reach out and support each other in close proximity. We need to be in contact and supportive in every way we can. This is a very strange time. I just don't think any of us could have imagined the combination of circumstances that we find ourselves in. And so we will be in a different place a year from now, and hopefully building better systems for future crises, hopefully having a sense of how we're all in this challenge together. That would be a beautiful development. And I'm going to keep providing as much information as I can on my website, merkley.senate.gov/Main Street. We set this up to try to put out as much information on every aspect of the business challenges, small business challenges, as we could. So we've been updating that pretty constantly. We've had a list of the banks and credit unions that were providing the PPP program to groups other than their current clients, because there were only 4 initially in Oregon when we surveyed all the credit unions and banks, only 4 that were open to PPP for folks who didn't have an existing banking relationship. Now there are more. I have them listed on my website. As we get clarification on issues like how to better facilitate an idle loan/grant application, we're trying to share that information. So merkley.senate.gov/Main Street. Call Courtney, call Jake. National policy issues for the next bill, call Allison. And we're just going to keep working to try to pave a better, more successful road to the year ahead. Thank you so much. Pleasure to join you.
You're so welcome. Thank you, Senator, for all the work that you're doing and for your service and representing us in Washington. So with that, we'll say goodbye. Thank you so much.
All right. Thank you.